I do have sympathy, Lisa. Like, what comes to mind, I remember a patient who came in and her sweating and her odor was debilitating for her. And, we worked on hormones, we worked on a couple things, but one of the things we had to do was work on changing her deodorant. And it never, like, it blows my mind every time I think about it. I remember seeing her like 6 weeks later, she came in hugging me and crying because her smell significantly decreased. So I think, when people say that natural deodorant doesn't work, yes, when we say the way it's really supposed to work, when it works with the body, not against what the body wants it to do, which
love
is what
that. I
does.
love that, working with the body. And it's like, if you could see, I've been able to see Alain tell his story, and it's, his product really is a solution to something. And it's so hard, Mick and I spend so much time in business development and marketing, and it's like helping a brand tell a story. And Alain has been doing, it's education, right? Alain, like, it's costly to do the education to be able to sell your product. And, Alain is a pioneer in this. It's like a solutions oriented product, and we have to stop rejecting it, right?
Yeah.
We have to embrace it. So Alain, do you find, I can say, if I'm setting you up here, which I always do, right? So is your product work for everybody, or do you have to like date a natural deodorant to find the right one?
Mm-hmm. Well, first, if we look at the deodorants 20 years ago, compared to the deodorants today, it's night and day. The efficacy is right up there. And actually,
about the natural deodorants.
About the natural deodorants.
Yeah.
Yes. And basically, how do we know if a deodorant works? Well, we actually do a clinical test. It's done by an external laboratory in Montreal. So what they do first, they recruit 20 people. And those people, if they want to be part of the trial, first they have to detox for 2 weeks. They are not allowed to use any antiperspirant. Reason being is that they need time to get rid of those plugs.
Right. Thank you. I was going to say, please tell everybody why. This is so important.
Because if you were to pick the people and then they've used antiperspirants for the day before, and you do the trial, and the trial, the way they do it is that the subjects come into the lab, and a lab technician will apply the test deodorant, and they'll do a base smell. And there is actually a thing called master sniffers. Those people do exist. They've been trained to sniff armpits, right?
I just learned something new.
Yeah, and they'll do it at 12 hours, and they'll do it at 24 hours, right? And there's always also a control group.
So wait, I have to interrupt 1 second, because you bring up something really important that we're going to go back and talk to Kim about after. But so if you're switching from whatever you're using to a natural deodorant, and you cannot say it doesn't work, do not come back to any of us and say it doesn't work on day one. There has to be a detox process.
There has to be a detox. Yeah. And by the way, the study that I talked to you about that showed that some of the aluminum gets into the body. When that study came out, the FDA and Health Canada hasn't followed through yet. I'm assuming it's just a question of time. But I've noticed that these brand companies, most of them are US. That's the aluminum-based antiperspirant. They started adding a new warning. In the States, it's mandatory. And the warning on antiperspirant, and I know, I can't believe, I don't know anybody that reads all that little fine prints in the back of their antiperspirant, but it does clearly say that if you have kidney disease, that you should consult your healthcare practitioner before using this product.
How alarming is that?